Diastasis is a separation of the midline abdominal fascia. Fascia is that gristle tissue, that very strong inelastic tissue that we have throughout our body in various places that covers muscles. And between your vertical rectus muscles, there is a thick layer of fascia. When a woman becomes pregnant, that layer of fascia must stretch to accommodate the growing fetus. So the space between the rectus muscles widens, and exercise is ineffective to bring that together because, again, it's not muscular tissue, it's fascia. So exercise doesn't really change the degree of separation that's present. Exercise can improve the strength of the rectus muscle, but it won't change the gap between the muscles. Frequently, a woman who has a significant diastasis will notice that when she does a sit-up or crunch, abdominal crunch, there will be a tenting effect in the midline between above and below the belly button, where you can actually see a bulge present, and that represents the separation of the rectus muscles. So exercise is ineffective to improve it, but surgery is effective. It can be treated. It requires a tummy tuck procedure whereby an incision is made along the lower abdomen and the skin is lifted away from the muscle and the separation between the muscles is repaired. It's a very effective technique, rarely recurs, so it holds up well over time. I ask my patients to wait 3 months before doing abdominal exercises so that the repair is strong and sturdy before it's challenged by core exercises of the abdomen.